So there are three stages of carpal tunnel syndrome. There's mild, moderate, and then severe. The way that we diagnose these at this point, for the most accurate way, would be with the test called an Emg test. That test involves you going to see a practitioner that will test the nerves with some shocks, and then also test some of the muscles, and that will allow us to see how diseased or how damaged the nerve is in the palm. Oftentimes when people have carpal tunnel syndrome, the things they're complaining about primarily are numbness and tingling in the fingers or the hand, shock-like sensations in the palm or in the wrist, the fingers falling asleep, losing dexterity in the fingers, potentially dropping things. These are the really common things. Also waking up at nighttime needing to shake the hand out. Those are really common symptoms of carpal tunnel syndrome. People often have wrist pain as well. So when you come see us about that, what we'll do is we'll set you up to have this Emg test done, and then we'll also ultrasound you in the office to see if you're a candidate for the procedure. At that point, once the EMG shows us how severe the symptoms are, either mild, moderate, or severe, we can determine a treatment plan. What we're usually starting out with in the mild stages are some non-surgical interventions, which involve resting night splints, potentially a cortisone injection into the wrist, some physical therapy for hand therapy to get some strength back, and oftentimes we can get these symptoms to calm down with these more non-invasive options. Once you get to moderate disease, we then want to usually look at going ahead and doing the procedure to cut the transverse carpal ligament or the carpal tunnel to make sure that you don't get to severe. The reason for that is once you're in severe stage, we can't promise you that the symptoms are going to completely resolve. We know they're not going to get any worse, but we can't say they're going to go back to being normal. So oftentimes when you hit the moderate stage, we're recommending that you have the carpal tunnel release procedure done. We can also do the procedure during the mild stage, but if you haven't tried any other interventions that are non-invasive, we oftentimes like to try those first to see if we can improve the symptoms.